Hello everyone, welcome to Dr. Young's live taped channel. If you like my video, please thumb up. Please also subscribe to my channel. In this way, you will not miss any new videos. Today I'm going to talk about coronavirus, the UK's government response for the health information and advice to the public. The COVID-19 is a new illness that can infect your lungs and airways. It's caused by a virus called coronavirus. What's the risk of coronavirus in the UK? The UK chief medical officers have raised the risk to the public from low to moderate, which means the government realizes there's danger to the UK population. The health professionals are working to contact anyone who have been in close contact with people who have coronavirus. The advice for people returning to the UK and travelers to the UK. There are some countries and areas where there is a high chance of coming into contact with someone with coronavirus. For example, China, Hong Kong, Iran, Italy, Japan, Singapore, South Korea. What's suspected to have coronavirus? If you have been to one of these places or close contact with someone with coronavirus in the last 14 days, then you need to find out what to do. To protect yourself and others, the UK government specifically asks people do not go to a GP surgery or pharmacy or hospital. This is slightly different from the action from other countries. Normally, when you feel ill, when you suspect you got coronavirus, you will go to see your GP or you will go to the A&E, to the hospital to see the doctor. The why the UK government advises people not to is because if you have a coronavirus, if you go to the GP, if you go to hospital or pharmacy, you will spread the disease, the virus, to other population, which increase the risk for the outbreak. So when you suspect that you have coronavirus, what you do is call 111 if you need it to talk to someone from the special service. When do you use the 111 coronavirus service? If you think you have symptoms, later on I will tell you, or if you might have been exposed to the virus while traveling. When you suspect these two, then you can dial 111 to ask for help. What are the symptoms of coronavirus? The first is a cough. So if you feel cough, that's one of the symptoms. Then you may have a high temperature, you have fever. However, in the early stage, you may not have fever. Then you may feel shortness of breath. When you have the third symptoms, which means you are in a more serious condition. However, do not panic. Even you have these symptoms, these do not necessarily means you have the illness, because these symptoms are very similar to other illnesses that are much more common, for example, cold or flu. How the coronavirus is spread? From the UK official answer is because it's new disease. So we do not know exactly how coronavirus spreads from person to person. Similar viruses are spread in cough droplets. This is general knowledge. It's very unlikely it can be spread through things like packagings or food. So the UK government advised public you may not need to worry if you just receive a package or you buy food from supermarket. Do I need to avoid public places? This is a very good question because recently, especially over the last 2-3 days, many universities discuss about do they need closed university or the church or the other meetings, conferences. Many international conferences right now consider do not holding the conference, cancel the conference. However, the UK government advice to the public is most people can still continue to go to work, go to school, or go to other public places. However, they warning the public, you only need to stay away from the public places. What they called is self-isolate. When do you need that? If you advised to by the 111 online coronavirus service or by medical professionals, which means do not just judge yourself. If the 111 service or a medical professional advise you stay away from public places, then you do that. Otherwise, you can carry on as normal. How to avoid catching or spread coronavirus? So the UK government lists what you can do. For example, wash your hands with soap or water very often. Do this for at least 20 seconds. Always wash your hands when you get home or into work. Use hand sanitizer gel if soap or water are not available. Cover your mouth or nose with tissue or use sleeves. Not use your hand when you cough or sneeze. Put used tissues in the bin immediately and wash your hands afterwards. Try to avoid close contact with any people who are unwell. What you shouldn't do is do not touch your eyes, nose, mouth if your hands are not clean. This is the only one advice the UK government gives to the public shouldn't do. How to self-isolate if you are asked to. First, you need to sit at home. Do not go anywhere. Not go to work, not go to school, not go to public places. Not use public transport or taxis. Ask your friends, family members, or delivery services to do errands for you. Try to avoid visitors to your home. It's okay for friends or family or delivery drivers to drop off food for you. Otherwise, avoid. What's the treatment for coronavirus? So far, there is currently no specific treatment for coronavirus. Then you may ask why we bother to go to hospital. Also, the antibiotics do not help, as they do not work against the virus. However, treatment aims to relieve the symptoms while your body fights the illness. So you still need treatment. You will need to stay in isolation away from other people until you have recovered. The next is you need to clean your toilets, a bathroom regularly. Think about a bathroom rota. If a separate bathroom is not available with the isolated person, use the facilities in the last. Use separate towels from anyone else in the household. Do not share dishes, drinks, glasses, cups, and towels, bedding, and other items with other people in your home. Wash crockeries completely with soap and water. Dishwashers may be used to clean crockeries and cutlery. Stay away from your pets. If unavoidable, wash your hands before and after contact with your pets. If you are living in shared accommodation, this is even more important. What you should do is stay in your room with the door closed. Only use communal kitchens, bathrooms, and living areas when it is necessary. Avoid using a shared kitchen while others are using it. Take your meal back to your room to eat. Do not eat in the public area. You can also use a dishwasher if it is available to clean or dry your used cutlery. If this is not possible, wash them by hand using detergent or warm water and dry them completely using a separate tea towel. What if I develop a symptom? So if you get a cough, a fever, or shortness of breath, call NHS 111 and tell them you have been asked to self-isolate because of coronavirus. Even if the symptoms seem mild, it is better to call for advice. What to do about work or other responsibilities? So during an outbreak, it is important to reduce the risk of further spread of infection. This will require understanding and support from employers, family members, and friends. You should talk to those around you, including your employer, about the importance of self-isolation to reduce the risk of spreading infection at work. If you are well, you may be able to work from home. Make plans with your family and friends on how to manage shopping, dropping children to school, and events. If you do find this hard, what you should do? For some people, self-isolation can be boring or frustrating. You may find your mood or feelings being affected, and you may feel low, worried, or have a problem sleeping. In this case, there's simple things you can do that may help, such as staying in touch with friends and relatives on the phone. That's old-fashioned. Or you can use the modern social media. You may find it helps to talk to them if you want to. The final advice for people traveling abroad. I know many university or government banned their staff to go to overseas, especially for some countries like China, Italy, and Iran and South Korea. If you are planning to travel abroad for any reason, unavoidable, you are concerned about coronavirus, you should check the countries by countries travel advice on the government.uk. In this website, include guides for 225 countries and territories. Finally, the NHS sent an announcement to the public recently. It says, if you are concerned about the coronavirus, or you just want more information, make sure you are getting it from a reputable source. Visit nhs.uk/coronavirus for all the latest updates, and use the new dedicated 111 online coronavirus service to understand what to do next. Please do not visit the practice, hospital, or pharmacy if you think you have symptoms. Please remember to subscribe to my channel. Thank you. 那么最后我用中文告诉一下大家英国国家卫生健康服务全民通告。那么它是这样讲的：如果你担心你感染了冠状病毒，或者只想了解更多相关的信息，请确保你从信誉良好的来源获得这些信息。你可以访问 nhs.uk/crossvirus 获取所有最新更新的并使用新的专用110 在线冠状病毒服务，了解下一步该怎么办。如果你认为自己有冠状病毒感染的症状，请千万不要去诊所，不要到医院，也不要到药房，因为这样呢，你会把病毒传染给其他人。